It's Tuesday, May 25. This is the news on PBCJ. I'm Simone Absalom Gale. Labor Day 2021 was observed on Monday. In previous years, there would have been a beehive of activities with a plethora of Labor Day projects across the island. With the COVID-19 pandemic a reality this year, the occasion was observed as a no-movement day, and persons were instead encouraged to stay home, stay safe, clean up your space. Prime Minister Andrew Holness says the government is working to ensure economic and social recovery from the pandemic. He shared how his administration is going about this in his National Labor Day message on Monday. Prime Minister Andrew Holness says the proposed social and economic recovery program is aimed at doing just that.
That is why we have announced the $60 billion social and economic recovery and vaccination program for Jamaica, the SERVE program, which will provide the foundation for the country's economic revival. Already, we are seeing the positive effects on economic recovery for countries that have attained high levels of vaccinations. We cannot afford to be left behind. We will be spending over $30 billion on infrastructure, including the Montego Bay Perimeter Road, which will mobilize local labor and skills.
He says $10.5 billion is to be spent on health, $6 billion on vaccines to ensure population immunity. The Prime Minister says small businesses will also get a boost.
We will be spending $5 billion on support for micro, small and medium-sized businesses to ensure that they can withstand the economic ravages of the pandemic and continue to create the jobs and income for those 74,000 persons and their families who may be without jobs and income. We will be spending $8.1 billion in additional care and social well-being support for the vulnerable and those unable to work and earn an income. We will be spending $1.7 billion for rural farm roads and productivity incentives to boost agricultural employment and production.
He says $1.8 billion will be invested in island-wide Wi-Fi and broadband infrastructure. According to Mr. Holness, infrastructural development and broadband internet is key to economic recovery. Minister of Health and Wellness Dr. Christopher Tufton says a multi-stakeholder National Health Information System Committee has been formed to guide the establishment of a digitized, integrated health information system. The project will cost about $8.5 million. He spoke about it during his contribution to the 2021-2022 sectoral debate in the House of Representatives last week.
Essentially, Madam Speaker, healthcare is going digital. That's really what it is. You go to the doctor at a hospital, you came from a clinic, the doctor uploads your information, you don't have to wait 2 hours to go find the paper-based file. It will have your medical history, which medication you are taking, what were your symptoms, how are you being treated, what are you allergic to, if you have x-rays, what those x-rays showed, and the doctor will be able to prescribe, having assessed you in a much more efficient way. It's about reduction of transaction time and cost for the benefit of the Jamaican people, and that is what health information systems will do. Madam Speaker, we're advanced with this, in that we're just about to sign a contract through the government procurement process with a provider to install the hardware, the networking of the institutions. We're starting with 3 hospitals and 9 or 12 health centers.
He says home care and telemedicine programs are also being planned, and a tele-echo program is also up and running to train healthcare professionals on the best practices in chronic care.
We have already trained over 1,000 healthcare workers in this area, Madam Speaker. We are preparing our healthcare workers for the next generation and for the future.
Caribbean Examinations Council CXC is under pressure to adjust the design of the upcoming Caribbean Secondary Education Certificate CSEC and the Caribbean Advanced Proficiency Examination CAPE. Hundreds of parents, students, stakeholders have signed a petition to urge same, but the latest voice comes from the United Nations Children's Emergency Fund, UNICEF. The fund says it's concerned the decision of the Caribbean Examination Council to maintain the current design. UNICEF has issued a statement calling for CXC and regional ministers of education to make adjustments to the content and administration of these exams, in line with recommendations provided by the Caribbean Union of Teachers, to ensure that the region's students are not further disadvantaged. The UN agency says that while it recognizes efforts already made by CXC, it believes that there are still a number of issues which require more substantial changes and flexibility. Morant Bay High School recently commemorated its 60th anniversary by planting 60 trees. Several persons, including Member of Parliament Dr. Michelle Charles, were on hand to participate.
Acting Principal Marsha Ford Bryan thanked the Forestry Department for partnering with the school to make the ceremony a reality.
It's a symbolic day for Morant Bay High School. We are celebrating our 60th anniversary, and to do that, we have one such activities that we have planned, and that is our 60 for 60 tree planting activity. Now, today would not have been possible without the input of some very valuable individuals and stakeholders. We use the opportunity to thank the Forestry Department for contributing the seedlings that we have planted today. And this was done free of cost. We appreciate the partnership and we aim to continue this partnership.
Former Eastern St. Thomas Member of Parliament Fenton Ferguson participated in the tree planting, and current MP Dr. Michelle Charles was also at the ceremony.
I had a representative that was supposed to represent me today, as I'm supposed to receive my second dose vaccination. But when he told me that he was running late and he couldn't make it, and unfortunately I missed the 60th anniversary celebration, I said, forget the vaccination, let me rush over to at least come and bring you greetings and say how happy I am for 60 years, Morant Bay High School. And I'm happy that I made it in time to at least join you as you plant 60 for 60 trees.
Morant Bay High School was founded in January 1961. The tree plant initiative falls in place with the government's push to plant 3 million trees in 3 years. Melvin Pennant, PBCJ News.
We now go to the business desk with the latest market details from host Gabriel Thompson.
In Friday's trading session, the JSE combined index declined by 413 points to close at over 400,000 units. Overall market activity resulted from trading in 95 stocks, of which 35 advanced, 44 declined, and 16 traded firm. The junior market index declined by 17 points to close at over 3,000 units. Stocks advanced for Blue Power Group, Cargo Handlers Limited, and Caribbean Cement Company Limited. Stocks declined for 138 Students Living Jamaica Limited, 1834 Investments Limited, and Access Financial Services Limited. Trading firm were CAC 2000 9.5% preference shares, Caribbean Assurance Brokers Limited, and Community and Workers of Jamaica CCU deferred share. Sagicor Select Funds Limited Financial was the volume leader with 5.2 million units, followed by Future Energy Source Company Limited ordinary shares with 4.6 million units, and Wigton Wind Farm Limited ordinary shares with 2.7 million units. In foreign exchange trading for Friday, May 21, the US dollar sold for an average $149.79. The Canadian dollar ended trading at $125.14. The pound sterling traded for $213.15, and the euro sold for an average $184.22. Oil prices slipped on Tuesday but were near one-week highs after jumping more than 3% the previous session as investors tempered expectations of an early return of oil exporter Iran to international crude markets. Brent crude futures were down 30 cents at $68.16 a barrel. West Texas Intermediate crude futures dropped 42 cents at $65.63 a barrel after gaining 3.9% in the previous session. And on that note, we close this Tuesday edition of the Business Report Inside the News on PBCJ. I'm Gabriel Thompson. Pleasant viewing.
In regional news, despite a report from the Pan American Health Organization, PAHO, last week, that many Caribbean countries, including Trinidad and Tobago, have seen COVID-19 deaths double, epidemiologist Dr. Avery Hines says this does not mean the death rate is increasing locally. He explains that as the COVID-19 numbers continue to spiral, there will be a cumulative increase in deaths. Sunil Lala reports.
Technical Director of Epidemiology Dr. Avery Hines says the COVID-19 death rate locally has stayed around the same figure in the past year.
The number of deaths, 375, over the total number of positives currently, which is 20,017, we get a case fatality rate of 1.8 something. And that has been really within the sort of the range that we have seen at the height of the previous peak.
As of Sunday, May 23rd, there were 206 deaths recorded for the month of May. Dr. Hines says the increase in deaths is expected since COVID-19 infections continue to rise and reach more vulnerable people. Last Wednesday, PAHO Director Dr. Carissa Etienne pointed out that only 3% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19 and noted that deaths have been doubling in several countries, including Haiti, the Bahamas, and Trinidad and Tobago. Dr. Hines points out that isolation for COVID-19 positive patients at home is critical to avoid spread to other family members, especially those who may be most vulnerable. He says if everyone continues to take as much precautions as possible, there could be a decrease of COVID-19 infections 2 weeks from when the state of emergency was implemented. According to the epidemiologist, they had noticed a slight decrease from restrictions that were implemented on April 29th.
While we're still seeing an increase, or we're still seeing large numbers, we're not seeing that increase being as exponential as it had been. It didn't remain on that very exponential track that it was on in the last 2 weeks of April. And we attribute that to some extent to some of the reductions in mixing beginning to have the desired effect.
Dr. Hines said as of 8 a.m. on Monday, total occupancy rates for COVID-19 patients at hospitals stood at 72%, with the ICU occupancy rate at 85%. Sonolala, TTT News.
Mobile vaccination sites will be popping up all over St. Lucia as part of a concerted drive to get more people vaccinated. On Friday, the HTS News Force team stopped by one site to gauge public participation to the march towards population immunity.
Vaccination Friday. Yeah, I'm back in a different way, you understand?
Closer and more accessible to you. The Ministry of Health has re-strategized its campaign to roll out COVID-19 vaccinations by going mobile. On Friday, a temporary tent was erected near the Grosley minibus parking lot for people desirous of accessing the life-saving vaccines.
We know that people are busy and they have things that they need to get done. So whilst they go around their normal business, be it at a shopping mall or at the bus terminal waiting for their buses, at supermarkets, we have vaccination being done on site.
Director of Health Education at the Ministry of Health, Natasha Lloyd-Felix, says the mobile vaccination effort also caters to people seeking clarity on the COVID-19 vaccines.
We have chosen to use this to do a lot of dialogue and education and a lot of listening to the concerns of the public, because we know there are questions people have and they need information to help in making an informed decision to get vaccinated.
Thus far, Lloyd-Felix notes a positive response from members of the general public who have accessed the mobile clinic. A patron at the mobile site, Neri Gilbert, touted the convenience of the location.
I came to take the vaccine to be safe. Yeah, I believe in the vaccine. My mother from Florida told me she took it and nothing, so she told me go and take it. And since she's the one that's responsible for me, I came to take it. I wouldn't feel any side effects, nothing. I didn't even feel the prick. The woman was so gentle. I asked her if she had given it to me already. Yes, it's good so, because there are some people that can't travel far or they can't go nowhere because some people in war, some people this and that, they don't have transportation. Bring it in the areas, that's the right thing.
A loudspeaker blaring music drew the attention of onlookers and beckoned interested individuals to visit the mobile clinic to get vaccinated as the island seeks to achieve population immunity. Solange Alfred, HTS News Force.
In Barbados, still no date yet for the common entrance exams, but the education minister says the announcement could come within 2 weeks.
The minister gave the assurance over the weekend and promised that anxious students and parents will not have to wait much longer to know when the exams will take place.
Don't worry about the 11 plus, because I know many people worry about the 11 plus. I told the country we were going to do the assessments on the children. The assessments are underway, and I give the assurance that within the next 2 weeks or sooner, we will have a position as far as the 11 plus date is concerned. That is our commitment to you.
In sports, we kick off with football. For months now, the National Premier League has been in suspense, waiting for the green light from health authorities for the league to resume. That reality is now closer than ever, as the format and the dates for the new season were recently announced. We get more in this story.
The government of Jamaica has been working assiduously to put measures in place to allow for the resumption of the National Premier League.
It has taken a longer time to get this sector starting based on the higher risk that comes with the contact in the sport of football. But as Jamaica emerges from our highest figures and having begun our vaccination, we are confident that with the support of all stakeholders and partners, we can safely play football.
The Professional Football Jamaica Limited, in continuing efforts to stage the Jamaica Premier League this season, recently announced the format and dates.
The 2021 Jamaica Premier League will be as follows. We will have one preliminary round of 66 games. In that preliminary round, as is customary, each team will play each team once. That will be followed by 6-team selection, so that we will break into 2 groups. The 12 teams will be ranked based on points, and 6 teams will go into the top tier, and 6 teams will stay in the lower tier. The 6 teams in the lower tier will play a round robin against themselves, and they will again be given points, and they will now be playing for ranking 6 through 12. The top 6 teams will be broken into 2 groups. The top 2 will go straight to the semifinals, and the bottom 4 of the top tier, that is ranks 3 through 6, 3, 4, 5, and 6, that 4 will play a round robin and 4 points, and the top 2 on points will join the rank 1 and 2 and go into the semifinals. The semifinals will be a 2-leg round, and the winner of each semifinal based on the 2-leg round will move to the final. And the final will be a one-game knockout.
The league will kick off on Saturday, June 26, 2021, with the final match culminating on Sunday, September 26, 2021.
This season alone, although shortened, the staging of the league is estimated to generate over 200 million Jamaican dollars in the economy. It definitely is not just about football. Last month, as a ministry, we began the discussion about how we can elevate the game by building the mental muscle of the mind. During this pandemic, many Jamaicans, not just athletes or footballers, had to dig deep as we navigated the mental pressures of a lockdown, of feelings of isolation, of job losses and personal losses, of losing loved ones, of abuse, of adjusting to this new normal. These issues were compounded by not having the outlet to play sport.
Minister Grange also announced a partnership with GC Foster College of Physical Education designed to improve mental strength for top performance in sports.
To provide training in the area of mental resilience and agility. We are supporting this by subsidizing the cost for interested athletes and coaches to access the training at a cost of $2.2 million. I encourage you to make the best of the opportunity even as we build out the program. So it is not just about football. It is about building the mental capacity of our people to cope with adversity, to instill discipline as our athletes and their support teams learn ways to play the sport while observing the very strict guidelines and protocols for being part of this league.
For the news on PBCJ, I'm Carol Francis.
And with that, we call an end to today's newscast. You can join us right here tomorrow, same time, for more news on PBCJ, the People's Station.